Hello, everyone. This is Dr. Bruce B. Baird, and you're listening to the Productive Dentist Podcast. In this podcast, I will give you everything that I've learned over the last 40 years in dentistry, working with thousands of dentists. I'll tell you, it's not that my way is the only way, it's just one that has worked extremely well for me, and I'd love to share that with you so you too can enjoy the choices and lifestyle that productivity allows. More time for things you love, increased pay, better team relationships, and lowered stress. Let's get into it with this week's episode of the Productive Dentist Podcast. Hi, this is Dr. Bruce Baird with Productive Dentist Podcast, and I have one of my favorite people in the world, Machell Hudson, with me today. Machell, how are you doing?
Excited to be here, and thank you for the invite. It's lovely to always be able to spend time with you.
Oh, thank you. Well, I tell you what, Machell has turned into one of the top oral systemic educators in the entire country, and I'm so proud of you, Machell, for what you've done over the last 4 years, 5 years. Has it been 5 years now that you've been out lecturing?
Um, uh, well, you officially pushed me out into the scary world, outside of clinical in late 2016, or I guess that's when I was brave enough to say, "Okay, I'll do it." And I started speaking in 2019.
Yeah, golly, it's just time's flying really quick. For those of you who don't know, Machell actually worked in my practice, and everything that I know about hygiene and oral systemic, we kind of learned together over over multiple years, and it just became part of the way we wanted to take care of patients. I mean, when we think about, we have that new program called Clinical Calibration. You've been doing some programs and you've done some phenomenal stuff, but it's like getting everyone on the same page, and hygiene plays such a major role because without, and I know there's controversy out in the country about hygiene in dentists right now. It seems to be a big deal, but to me, it's not about hygiene in dentists. It's about patients and how do we give them the highest level of care possible. What are the things that you think of, when you start thinking about taking care of patients? It really doesn't have anything to do with annual maximums on their insurance or anything like that. But what does it boil down to, Machell, when you're looking at a patient?
The whole person, curiosity, life experiences, and our role as healthcare professionals in ensuring that we're providing the highest level of care.
Right. Yeah. Do you find that, when you talk about, personal relationships and everything else, I always tell people, I really only like to work on my friends. And I know you, and you're an easy study, and you're somebody that's very easy to get to know. You're very open and caring and sharing and that type of thing. Do you feel like that's been one of your most valuable tools that you have? It's not necessarily just personality driven, but it's also what you're focusing on, isn't it?
I think that when I was 9 years old, and you know this, Lulu knows this, and I knew at 9 years old that the one thing that I was gonna grow up and do, I knew that what I was supposed to do was to love people well. And, am very curious about who people are, highlighting the things that I love about people, and that very much one of my avenues to be able to love people well, is being a healthcare professional, and that was beautifully complemented when I said yes to a job that I wasn't even looking for a job, but I said yes to Granbury Dental Center and working for you and Jeff, because it wasn't just me alone loving these patients and being curious, why are they taking these medications? What is this disease that they have? And oh my gosh, airway. And did aliens just land and I'm walking in like this woo-woo world now? No, we were connecting with every patient and, we were, Bruce I I appreciate it so much. I am not money driven, I am mission driven. However, Bruce always believed in paying his hygienist very well, and so we were paid on production. Um, but it wasn't about the money for me, it was about what you always said, is because I would go and ask if I could do something free for a patient, or I'm concerned about, XYZ, and you're like, "You're the healthcare professional, you do what is best for them, and you let me know what you need." And, that speaks my love language. So, it's all about relationship. It's all about relationship.
And that's really the whole thing behind PDA. I joke with people all the time about, what a lousy boss I was, and I was for a long time until I realized about relationships with the people. I thought, well, I'm the boss. This is how you do things. Just do it way I say, and everything will be fine. But then I realized that the most valuable time that I could spend, besides being with patients, but was also being with my team and teaching and educating my team. And I was on the phone with another doctor yesterday, and I was saying, if you focus on the money, that's a problem. Because you tend to become more piecemeal oriented. Oh, we need to do another this, we need to do another that, as opposed to getting to know the patient, first of all, getting to know about who they are, and then becoming a consultant to that patient. In other words, I'm your consultant here. And it's not like, oh, well, you have gum disease and you have this and you have that and you have this. It's like, what kind of medications are you taking? What I'm going through. So tell me a little bit about how health history leads you into building that relationship.
Um So, personalized care. We practice and what we're teaching in Clinical Calibration Institute is even a step further, even though I feel like we were doing it really well before we actually had a name for it. Uh, but we were risk factor driven, and in your office, we did that by having an understanding of periodontal risk, caries risk, function, airway, which again, 20 years ago, these are the pioneer years of dental sleep medicine, and then of course aesthetics. But in order, like, P4 takes it a step further because it is, of course, predicting the patient's disease risk, focusing on prevention, which I feel we did really well even in those early years. We did as well as we knew how to do, and we were collaborating with medicine and referring to nutritionists, etcetera, which I'm really proud, and now doing it so much better. But then personalizing it, and again, without having a name for it, Bruce, don't you feel like we did that really well? Like, we got more yeses than most because we were connecting with the person, the whole person, and the beauty of P4 was partnership between we, the healthcare team, and each patient. And we did that really incredibly well, even a long time ago, given the information that we had at the time. And 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 so to truly personalize care and predict disease risk, those personalized care tools are going to be our health history, they're going to be Carrie's risk assessments, we know, is salivary diagnostics, and then connecting with the patient and truly understanding their experiences, their goals, not their chief complaints. Let's get away from the negativity. What are our goals here today, Bruce? Thank you so much for trusting our team. I am so excited to get to know you, and we are so excited to take care of you. Instant connection. Will you share your goals today? And then is it okay if we walk through your experiences with your health? That's instant trust between our team and our patients. And so the health history is that first real connection between the healthcare professional, and it sets the stage for everything that's to follow.
Absolutely. Yeah, there's no question, and this, this whole concept of clinical calibration is what we were doing for 20 years. We wanted to have our I didn't just wanna have you and I to understand the oral systemic risk because we were learning, but I also wanted my team, chairside, the hygienist. I wanted to have our, uh our administrators. I wanted to have pretty much all of the team to understand what it is we do, because your person at the front desk could have very easily just come from the bank as a bank teller or whatever. They may or may not have experience. And to be honest, I'm a-okay with hiring somebody with absolutely no experience because I want to teach them from day one, what our philosophy is. When I say our philosophy, it's a team philosophy of this is how we want to do things. And so it's kind of funny. My first 15 years in practice, I'd hire you and say, you know what you're doing, just go do it. Because I got so much stuff going on, and I'm in debt, and I'm just trying to make a business work, and I don't have all that. I think if I take time to train you, I'm taking time away from being with patients and making money. And when that changed, when I said, it was probably the early 90s when I was looking at the practice and I had a couple of choices. I could make this a heavy PPO driven practice, which I don't care what kind of practice you have, but I could be a heavy PPO, hire 3 or 4 dentists. I could be on the golf course every day. And but that wasn't my philosophy. That's not why I got into dentistry. And so I decided I was going to be high tech, high touch. You became a huge part of that, as did the entire team. And as we brought in all kinds of technology and we began to change our focus and I don't want to say change our focus because early in my career, man, I was going to every course. I was learning at the top levels, but when I'd come back, my partner, oh, he never went anywhere, never went to any courses. And then when we kind of separated, I had that choice. We can do this, that, or the other. But our hygiene department to me was so critical in in building the kind of practice that I wanted to build, which was working on friends, working on, having it, even though we weren't marketing and advertising that, we only work on our friends. We would get in relationship with all of our patients from the front office to the back, and it became very easy to market, and a lot of it came from them, from the patients.
Yeah, I'll tell you, um, um, one of my greatest gifts from above is knowing you and Cynthia and Jeff and experiencing the way that we were able to love our patients.
Yeah.
Um, we learned together, we grew together. It was messy at times as we were taking on these new, like, initiatives, so just so many people I hear all the time, "That's too hard, it's too much." Well, let's goal set to success, and there's always gonna be that uncomfortable, but train your brave, and, because our patients deserve it, and guess what? We do too, and that's what we did in our office, and we had you cannot be successful at this without I know everybody wants to say the heart of a practice is the hygienist. Well, we do get to spend the bulk of the time with the patient. However, I just disagree with that statement. I believe that everybody, when you have a calibrated team, that whole team together is the heart of that practice. And that's what we experienced thanks to you, Bruce. And I will love you forever. For I am who I am today in large part because of what you allowed us to do in our practice.
Well, I appreciate that. What I can tell you is if you want to have a practice at the highest level, and I'm talking to docs right now, you're not going to do it by yourself. You can think you are, when I say you're the source, yes, in many ways you're the source of the information that gets to your team. But if you're narrow in your scope, if you're, oh, we're going to do more crowns this month, or this, we didn't do enough fillings last month. If that becomes your focus, which is very insurance driven. And, because, oh, we can only do this much this year because of insurance. What are your thoughts as far as hygiene and insurance, dental insurance? Is that something, do you look first at their insurance and then look and decide what you're going to treatment plan? And why do you go in and do blood pressure and health history and all of that? So why do you do that first after you've gotten to know them?
Um, so I'm gonna set this up because I think it's really important, because we're already getting, there are people who are like, "There's just no way that this happened or that it could be replicated." I'm gonna share with you, what you already know, but with everyone watching and listening is, uh, w w under it when you practice this philosophy of care, where you're treating the whole person and you're partnering with this patient, um, and you will see, and it takes about 4 to 6 months for this to happen. But what you're going to see is patients, and I experienced this for my entire career working with you, Bruce. For the first time, patients always love, or almost always love, the majority love their hygienist, their doctor, right? And, but I'm gonna tell you, what you know, but maybe some of you don't. The pandemic is a perfect example. Um, they're gonna love me all day long because I'm fun and I love talking about their experiences and seeing them and catching up, whether it's 3, 4, or 6 months. However, we go through a challenging season. We lose someone that we love, financial um, uh, um, uh, um, tragedy, um, pandemic. This is what's different. When you're in relationship with your patient and they have full understanding, there is clarity in why they need to come and see their hygienist every 3, 4, or 6 months. And please, let's like underscore this is not determined based on if they are a healthy prophy patient, a perio patient. We're also looking at the health history, we're looking at the airway, perio risk, and caries risk. Because guess what? You know as well as I do, we had patients that were not a perio risk, but were a high caries risk, and they got to hang out with us more often. And, and that has to start with bringing, so everyone thinks, Bruce, and you know this, why are patients not accepting treatment? Why do patients not accept treatment? Most people are gonna say cost. Wrong. So, enough surveys out there that show that the reason patients do not accept treatment, actually, the more majority is going to be because they don't trust their healthcare professional. So, that's you, doc, or me, hygienist, and we're the providers. Two, three, and four, according to one survey. So, one, two, three, four is trust and understanding. And finally, fifth, reason is financial. There's other surveys. Overjet just did one too, very much complements that same survey. And so for us to bring clarity to our patients, they have got to, and they deserve to understand what their disease state is, what their risks are. And if we are not starting with that health history, understanding beyond what used to be the standard of care, but actually understanding cardiovascular risk, dementia, Alzheimer's risk, autoimmune, and how each of those airway risk when you're doing Epworth, stop bang, or even asking about their sleep. What are their behaviors, lifestyle behaviors, drinking, smoking, diet? And even if they don't have an airway problem, how do they sleep? Connecting all of those pieces before you've ever even looked in their mouth, you already have a pretty good idea of what their risks are gonna be between periocaries and airway. You're starting that conversation then, and you can do this, assistants, you can do this really well, and hey, we even train business team to have a foundational understanding, so you can do that first interaction is on the phone and a patient calls with concern, and you can be that first touch point about airway risk. Keep it simple. We're not trying to like pack on too much healthcare responsibility with our team. We're just trying with our business team, but foundational and being able to have this consistent communication throughout the entire practice brings clarity and trust to the patient. Let's move to blood pressure. Look, this is one of my pet peeves when anyone says, I don't have time to do blood pressure. You don't have time not to do blood pressure. We know 1 in 3 Americans have hypertension. Only 1 in 4 are are controlled. And we know that there's not a little bit of connection between our bucket of care, so periodontal carries pathogens, and hey, guess what? Airway screening is in our bucket of care now too. There is significant connection between blood pressure and all of these risks. We have a responsibility, and actually in many states, Texas, where we practiced, we absolutely had to take blood pressure. There was no, I don't have time. When you start explaining to your patient why there is this connection, it's why do you take my blood pressure in the dental chair anyway? I'm just here for a cleaning. Oh my gosh. I haven't seen you in 6 months. Let me share with you what our team has been learning. And then connect perio, connect airway, and connect periapical abscesses. And I'll tell you what, you will always have some, like, negative Nellies that come in your office, but 95% of your patients are going for the first time see real value in what you bring to the table in their health. And
Yeah.
head and neck exam, I wish we had a lot of time. I'll tell you what, that's probably the most in the modules, the most time I spent was in those head and neck modules because there is most people think head and neck, Bruce, and they think cancer screening. That's all we're doing is cancer screening. Significant, right? We know that head and neck cancers continue, new cases continue to rise. This is we just like blood pressure, it's not if we have time, it's we don't have time not to be screening. And I know just in our office, there were 5 of my patients that we referred to Dr. Warner's office and diagnosed with cancer. That's just in my time with you, Bruce. I had a patient in an office before that. So if you're looking I was told a long time ago by one of my professors that we probably would never find cancer in a patient. Um, uh, the prevalence keeps increasing. I venture to guess that believe that most of us will find cancer in our patients. And for
Guarantee.
can't not look, and if a patient is diagnosed with a head and neck cancer and you did not have this conversation, that is on you, and I would not want that on me. I would not want that on my shoulders, because this is a significant quality of life destroyer.
Sure.
And
I always love it when docs, they see something, they see a lesion or they see something, they go, I don't know what that is. And, they may not even say that out loud. They go, yeah, we'll keep an eye on that for 6 months or whatever. Well, or they'll put it out on the threads. How do I treat this? Or how do I treat that? I go, I treat it really quick. I call Mike Warner, my buddy up in Weatherford, oral surgeon, pathologist, and I go, hey, I got a patient I want you to check out. I, you know, We don't have to be everything for everybody, but what we have to do is be able to visualize, hey, this is different. This is not necessarily normal. So let's find out exactly what it is. And one of the things that you did so well and still do so well is, I mean, obviously communicate, but it takes patience from, I know I hear it after every exam, and I know you heard it, but it's like, why has no one else done this before? And it's easy to throw somebody under the bus, but I like what you said a little bit ago. Oh, well, I don't have to throw anybody on the bus. All I have to do is say, "Oh my gosh, we're learning so much new stuff. I'm sharing with you new stuff." And I think the role of a hygienist, and tell me if I'm on track, but it's being of a healthcare profession is being a consultant. In other words, I I have studied all of these blood, I've studied all of these, blood pressure and those kind of things. I love I love Wade Kiefer talking about, the heart attack gene, because Wade had a heart attack at 37 years old. Thin, good, ran, and everything else, but he had a heart attack. But he found out he had a gene that he had, with Brad Bale and Amy Donina. And so he talks to his patients that way. It's like, I have a gene that I have to take care of. You have genes, or you have a hereditary component to this that makes you more susceptible to gum disease. Does that make sense? Does that make sense? Does that make sense? And we're always asking patients, and as long as they're saying, "Oh, yeah, I mean, I didn't even realize that." I want to be the best consultant for my patients, and when we do that, money always takes care of itself. And just like you said, yeah, there'll be some negative Nellies that'll, well, I never had a problem before, and I went to a dentist before, and they never said any of that. Well, it more has to do with those patients being difficult to connect with. The ones I found, if I didn't connect with them, then my trust wasn't quite there. And I'm not connecting on a medical level or dental level. I'm connecting on, so you live over here. Yeah. So you know, I mean, some people are hard to connect with, but you are a master at being able to get in there and actually get to know the patient and building that trust. Same thing that Wade said yesterday when I was talking to Wade. He said, "Well, you build trust, and you just then you're that consultant." So, do you notice those things?
Yeah, what's funny is so Cammy, one of our best friends and a hygienist, and her room was always next to mine. And she would just sometimes, because I'm gonna tell you what I see. I am very real, and I take my responsibility very seriously. I'm not a disease babysitter, and, because that's practicing sick care, and I don't believe in practicing sick care. I believe in practicing healthcare with real care. And you were always very supportive of that, and so thank you for that. But Cammy used to, like, come around the corner when I'd walk some patients up, those difficult patients, and she'd be like, "Sometimes, like, I can't even bel like, your patients love you," and it's like, that patient I thought that patient was gonna get up and walk out, Michelle, and I think that's your patient for life. Those difficult patients, because I am so real, and I do bring clarity, and I understand you've always been treated this way before, but we know how to be better now, and I'm not here to tell you what to do, but, you are a stage 3 periodontal patient. That is a very high risk patient. You also have hypertension. So we know that periodontal pathogens, up to 50% of heart attack, there is an oral pathogen connection. And then hypertension, stroke, you have a 3 to 4 times greater likelihood of stroke. So where I understand you don't want this non-surgical periodontal therapy, you just want that regular cleaning. I can't provide that service because my license prohibits me from doing so.
Sure, sure.
And so I had a few of those, but,
Oh,
um
really? Yeah.
But the majority of them stayed, and even some of them stayed, like, pain in the butts forever. You know who we're talking about.
Oh, yeah.
And, but they showed up when they were supposed to. There was, not uncommon for them to push back, but you just bring the clarity. You just have to be very firm with them, and, and you know that you've improved their quality of life, whether they ever admit it to you or not.
Yeah, it's like being firm with somebody who likes you. That and that is, if they don't like you, then pretty much it doesn't matter what you say. And that's where that relationship and trust and all that, I mean, really plays an unbelievable role. But how did your, personal story, everything going through hygiene and everything. How did that shape you as far as hygiene advocacy and saying this is what I'm meant to do? I mean, when did that hit you?
Um So, in high school, I had a friend that was going to Texas Women's, and she was going into their hygiene program. And I've always been attracted to smiles, and I'm not talking just someone with beautiful teeth, like a supermodel or something. Um, um, Smiles like you can see a patient's soul with her smile. So I've always been attracted to that. So she tried to talk me into going to college with her, and I was like, you can kick me when you see me. Anybody who's watching this, you can kick me when you see me because it's the one time in my life that I did not see I didn't understand what it meant to be a healthcare advocate. But I was like, "I'm not cleaning teeth for a living." And, fast forward, I can't tell you how many times that I would be out. It's like I was just being led, like, there was no doubt it was my purpose or part of my purpose because I was, so often, "Are you in dentistry? Are you a hygienist? Are you an assistant?" Whatever, because I was young. And then I got pregnant and had a precious baby at 23, and, that is where my real first sense of purpose, blessed me, and, unhealthy relationship, with his dad, and although we get along really, really great, just not meant to be together, I knew I had to be able to take care of this baby and give him everything that he deserved in life,
Right.
and, without struggle, at least as much as I could control that. And,
Mhm.
dental hygiene is a perfect profession for families.
Yeah.
And I knew that I would work for doctors that supported family first, and, no one does that better than you, Bruce. And, and so I just instantly loved it, even before school, while in college, and there was just, it was very much who I was supposed to be. I loved it. Every freaking second that I've been in this profession, I have loved it. Monday morning was never hard for me. As a matter of fact, you remember how Karen used to tell me, Bruce, Michelle, you need to uh, like joy down,
Yeah.
like
Take a chill pill. Just relax a little. Yeah, I know. I know.
happy. And, and then I started working for you, and it was completely different. It was where I really was like, because again, y'all have to remember, I wasn't looking for a job. This was faith driven. And I learned very quickly that was going on under that green roof, Bruce,
Yep.
really special, and it was so much more, although I never felt that I was just a teeth cleaner, I never did I feel that way. Uh, but we were, having that treating airway growth and development, and then really being passionate about treating what you see, because I knew that periodontal disease, even in the infancy of really understanding oral and systemic health, I knew that inflammation in the mouth affected the body. And at that time, we really only had a strong understanding with the bidirectional and relationship between diabetes and periodontal disease, and then, of course, adverse pregnancy outcomes. But I just
Right.
knew that there was more. You believed that there was more. Jeff believed there was more. Our entire team knew that there was more. And then, so I just want everyone to just love and be passionate about the blessings that we have to be healthcare professionals, and the biggest significant driver in sharing outside of the clinical setting, because I never wanted to do anything else. I wanted to love my sweet patients for my entire career.
Yeah.
Was when Bryson, my son, my gentle giant, diagnosed with ADHD when he was in 1st grade, went to multiple doctors, integrative doctors, functional medicine, and everyone just kept telling me I was gonna have to medicate him. And even a child psychiatrist told me that if I didn't medicate my child, he wouldn't thrive in life. He got sick, tonsillitis, strep throat, upper respiratory infections. He slept terrible. And guess what? Doctors wanted my child in elementary school, Bruce, they wanted me to give my child Ambien. And I was just crushed. This holistic minded mama, and everyone is trying to push drugs down my baby's throat, and it was devastating to finally finding answers where I work, because it was one of our, um it was a doctor who didn't practice airway that actually took care of my son the first couple of years that I worked for Bruce, what you and Jeff. And I was so new in airway, and you couldn't just go learn it anywhere at that time. And so I was really focused on obstructive sleep apnea in adults, and then screening growth and development in children, and learning, and very uncomfortable at that time because there's education everywhere today. Uh, but I didn't even think about airway with my child, and when Jeff looked at him and we did a CBCT on him and we did a sleep study on him, and he was like, "You've got to get those tonsils out." And, his sleep study, he's a high risk when we did the sleep study, so fast forward to, we get those tonsils and adenoids out at 16, and, it was supposed to be 4 months for his surgery, and he was so severe, not the worst case the doctor had ever seen, but one of them. And so he got him in 2 weeks later for surgery. Tonsils, adenoids came out, he did some myofunctional therapy, and, that child is a sleep snob, because he, even today at 26, spent most of his life not knowing what healthy airway, healthy breathing was. And it's healthcare that, um, it's unintentional neglect not to look or ask about sleep. And Bruce, y'all, like, without you and Jeff prioritizing airway in this very new space at that time, and, you saved my child from all the things that we know happened when you have obstructive sleep apnea.
Yeah. Yeah, it's been, it's something that when I heard, when I heard some of the top people in sleep. In fact, I was at a sleep meeting when I first met Dr. Busky. Yeah, after I got him to come over and meet with me. But the funny part was I'm I knew that I had apnea, but I didn't understand all of it, and I didn't wanna wear a CPAP, so I wore 8 different oral appliances until finally I wear a CPAP now, and I live so much better. I mean, I sleep better. But as a kid, I was that kid, I was breast. I mean, I had allergies. I had, you see people with the crease in the nose from doing this all day long. Um, and I was ADD, ADHD, AD, whatever D, but I'm telling you, and back then we didn't take tonsils out. It was just, you know, when I was growing up, everybody got their tonsils out. Then it got to be where you had to have 9 positive strep tests before they'd do it. So I never got mine out. So I was one of those that was really suffering with ADD and ADHD. And then all of a sudden it gets to today where it's hard to get them. to get take their tonsils out. Well, now we're seeing so much more behavioral problems with kids, and that drives straight into adulthood. So that, those are all important things that I think differentiate the way that we talk to patients, the way we look at patients. Um, I want people to understand that this is not something that happens overnight. It has to be a philosophy that, and it has to be a philosophy that we don't know everything. And obviously, the more I learn, the more I realize I don't know. So I'm constantly reading, I'm constantly looking at stuff. I'm sending you stuff in the middle of the night. I go, oh, that's cool. And I know you've already read them, but I'm going to keep sending them. But it's just because and and I have put the handpiece down 6 years ago. So, but I did go in and do an exam last week on one of my friends, uh, just for the heck of it, because they wanted me to tell them what they really had, as opposed to going to the dentist and having them tell them what they need or whatever. And I think that's the difference in the way that we treat our patients. One other thing is that people get really freaked out about is, I mean, a lot of offices are selling to DSOs. They're going into that environment, and I don't think that that has to change. How, in fact, it's really wild. But I just got a text from one of my friends earlier this morning that we're on this. They want us to put on a new schedule, and I think this schedule it's going to really hurt us and all this stuff. And they don't want us to do this or they don't want us to do that. The bottom line is, I don't know of any DSO that is going to come and chew your butt out, Michelle, for being uh, a great hygienist, a great, what I'm saying. Did you notice? Because we sold to Heartland Dental back a long time ago. Did that change our philosophy?
Absolutely not. As a matter of fact, how often do they come and want to learn, from us? Because we were, always practicing at the highest level of care.
And
Yeah, and I understand the anxiety that teams have because we had it too. And, and I we were devastated, when you sold and then we learned, wait, okay, our, benefits are actually better.
yeah,
Through the pandemic, they really took care of us.
yeah,
And, when I had major shoulder surgery, I blew my shoulder out, and everything was repaired, and they were so kind through that entire experience. Philosophy of care, we kept doing what we had always done, and here, I work with a lot of DSOs, and I'm gonna share my and I would love your, um perspective on this too, Doc, is, there is here's the thing about social media, and, let's touch on the messiness between hygienists and doctors too, and you often hear the messiest is in DSO space. What we know is that what was it that you used to say, Bruce, that for every like, if you have an unhappy patient, they're gonna tell 10 people. If you have a really happy patient, they're gonna tell, like, 3 or 4
leave.
people.
Yep.
There is there are a lot of teams, they're really happy. I believe I've had this conversation with many people. We know there's probably about 10% of us in healthcare that are practicing at the highest level. There's about 40 to 50% that want to practice at the highest level, and they just need guidance and someone to build their confidence.
Yep.
Then we've got that 40, 50% that they're fine doing it the way they've always done it. And so if they want to practice sick care, they're poor patients. What a disadvantage to their patients. But let's focus on where we can provide change. And there are a lot of great DSOs that really want to provide really elevated care and bring the education and bring the opportunity to the team. And it has more to do not with the DSO. The majority of the time from the DSOs I've worked with, it's not the DSO that is the problem, it is the practice and the leader in the practice, and also this has got to be stated. If you are going in and if I meet you in the middle of the hallway and Bruce, you are not doing this for me and we have got to talk about it today, do you think that that is going to like Bruce is going to be like, I mean, that's not how you have a healthy conversation.
Well,
However, Bruce, can we talk tomorrow morning or tomorrow after work and bring the data? And remember when we wanted more lasers? And we're all sharing a laser, and it was pull your hair out because I did lasers on more patients than not. And,
right.
and and you said, okay, well, here's the goal. Is this a healthy goal? And if you meet this goal, we're going to get you whatever you want. DSOs are easy to work with like that. And it's not no to that raise. It's whether you're DSO or private solo owner practice. It is, are we listening to what everybody on the team needs? And so do we feel heard and are we intentionally also hearing what the other person needs? So when we all meet together, really that's where you're going to see and I feel like that's what we had. Not that there weren't some moments of messiness. Uh,
Sure.
um
Yeah. As long as, I mean, I think it doesn't matter who, in any business, I mean, it doesn't matter necessarily who the owner is. They're not going to affect me on what I'm telling my patients and what I'm doing with my patients. So that was kind of one of those deals, where they're not going to change me, there's opportunities. I knew that we could get better healthcare. We could, for all of our employees, we had a huge team, 26, 27 people, and it fit at the time. Would I do it again? You know what? I don't ever go back and say, "Oh, I wish I would have." I made the choices that we made. Tell me a little bit, and while we wrap up today, but thanks so much for being on with me this morning. It's been so much fun. But tell me a little bit about clinical calibration and what you've been working on, and what our listeners can expect from the Clinical Calibration Institute.
you know, it's like you get to bring everything that I have learned, since working, and learning with you, so it's all of that, and, it's teaching so we know that consultants, everyone should have a coach. Everyone should have a coach. The most successful people in the world always have a coach. And, so we always had coaches. We also know not everybody sees value in coaches, and there's a consultant on every block, or 10 consultants on a block today telling you they're promising you all of these things, and then they don't deliver. So there's a lot of anxiety around who do I use? Well, Clinical Calibration Institute, from my perspective is we're creating everything that we take as a consultant in from risk factors and really unpacking with clarity each risk. The overview is the why. So why is, the oral and systemic. Oral and systemic, don't bring oral and systemic into my office. I'm not ready for that. Well, guess what? It's the standard of care today, and it is what turns the light bulb on with for healthcare professionals and our patients.
Patience, yeah.
CCI is bringing that, with oral and systemic and so many more pieces. But what I'm doing is oral and systemic, weaving oral and systemic in through all the risk factors, staging and grading, it is just one piece of the perio puzzle, right? And, Dr. Kim Cooch has been a longtime friend of yours. A dear friend and a mentor of mine has done our caries risk and did you have you seen that? It's
Yeah.
so how we practice in our office was really Kim Cooch. Like, I know that you brought and I didn't even recognize that at first, but as I was getting to know, I was like, "Oh, well, Bruce and Kim, like, this is where our caries management comes from." And, 'cause he's brilliant. That's his
Yeah.
area
Well,
that
it's so hard to go to. Let's say you wanted across the board to raise your level of care. Well, in many ways, you're going to have to go to 10 different courses.
Oh, for sure.
This is the first time, and Kim even said that. He says, "It's the first time I've ever been able to teach caries management um, as a part of a whole." At least,
Without having a consultant.
yeah.
Um, there is nothing out there that I know that provides what you learn with, an elevated consultant, because there are different types of
Oh,
consultants.
sure.
So that whole body risk factor perspective from perio to caries to airway, group function into airway, and then real solutions, adjunctives, and because it's not a one size fit all. Do you agree with that?
Yeah.
So bringing it like, not everyone can use lasers, but what are other options? Subgingival airflow. Like we're bringing all of these pieces to one place. Case studies, masterminds, monthly masterminds. Jody and I do the mastermind for hygiene. You do the doctors. You take care of docs. Uh, hygienist and assistants. Man, if we train our assistants up, they are so great at co-diagnosis. They should be part of our co-diagnosis team.
Yeah.
Hygienist, there's no way, if done right, that we should ever have any anxiety about bringing and elevating our assistants. Do I want them doing our job? They don't need to be doing our job.
Right. Right.
They do play when it comes to airway management. I mean, that should be ran by an assistant, unless you
Yeah.
have hygiene doing myofunctional therapy and that's all she wants to do, or
Right.
he. But yeah, it's a one-stop shop, case studies, role playing, and then the next phase, we'll start, creating, what I love the most, Bruce, and that's where we actually start going through right now, we're weaving in oral and systemic through all the risk factors, and, but what we're gonna do after we finish adjunctives, so towards the end of the year is you'll start seeing cardiovascular disease and weaving in, which you've already started learning, but where we're talking cardiovascular disease and tying in, perio, caries, and airway, and teaching you how to communicate this with your patients. It's a one-stop shop. I think that's the easiest way.
Yes, and I mean, for most people that, you can go to productivedentist.com. You can see the information about Clinical Calibration Institute. I think the cost is like $500 or something a month for the entire team. So this is not, I mean, you don't have to take a team to 9 different courses, which would, but this is something. Back when I was first starting in dentistry, I learned. We didn't have the internet, we didn't have all that stuff. We learned in study clubs. Well, this is like a study club on steroids with the top leading people. A study club for me was going over with 5 or 6 or 7 or 8 or 10 of the top dentists in my area and learning from them. Now you're able to take the top dentists in their field, in their area of oral systemic or airway or caries control and all of that stuff. So anyway, I hope you guys take advantage of it. Machell Hoover, thank you so much for being an amazing friend and a great teacher. And I'm so proud of you. And I'm looking forward to CCI, and I'm looking forward to the next few years of watching how it grows into, I think, a phenomenal way of educating an entire team on where to go next, and what to do next. And we're going to always keep it fresh. But thanks so much, Michelle, for being on with me.
Thanks for, believing in me. I say this, so I carry you and our team, everywhere I go, and I'm so proud of where I come from. So I share often that every patient deserves for us to believe in them until they believe in themselves. And the same thing goes as a consultant. Is every team that we have the opportunity that we're blessed to work with, we get to believe in that team until that team believes in themselves, and that all is it began with you and Cynthia seeing something special in me and believing in me until I learned to believe in myself. So thank you for that.
That was easy. So, everybody, this been the Productive Dentist Podcast. Tell your friends about it. I look forward to the next time we're together, Michelle.
You too. Thank you.
Thank you for joining me for this episode of the Productive Dentist Podcast. If you found this episode helpful, make sure you subscribe. Pass it along to a friend. Give us a like on iTunes and Spotify, or drop me an email at podcast@productivedentist.com. Don't forget to check out other podcasts from the Productive Dentist Academy at productivedentistpodcast.com. Join me again next week for another episode of the Productive Dentist Podcast.